Herkes hoş geldiniz.
Hello, welcome. I'd like to thank the organizing committee of the Congress for giving us this opportunity, and I'd like to thank you for coming here on a Saturday morning to listen to us. I'll focus on psychosocial factors and risk factors and internet factors in addiction along with protective factors, and this is my model. Right, let's start with this cartoon. All three risk factors are together in this cartoon. So here we see that constant novelty is sapping the initiative, and he's saying he needs to stay away from internet. And 1 hour later, even before that, he reverts back to using internet. So actually looking for novelty or having online support and procrastination are all three risk factors shown in this cartoon. Now, we know that different models have been developed with regard to conceptualizing the internet addiction, and the first of which was the Davis model, the cognitive behavioral model. And this model posits that the problematic internet use stems from problematic cognitions coupled with behavior that either intensify or maintain these responses. And these cognitive symptoms include a ruminative cognitive style with low self-worth and depressive cognitive and thinking style, low self-esteem and social anxiety. And it uses the concept of distal and proximal reasons or causes. Well, distal reasons are more of a base structure, and they are loosely related with internet use. However, the proximal causes are more direct causes for internet addiction. Now, looking at distal reasons, we see, for example, trying the internet, presence of internet, or some sort of psychopathologic substructure, and also internet addiction might also lead to sort of maladaptive cognitions, and also we could be talking about the sort of social isolation. And with that, now we move on to the proximal cause side. We move on to the factors such as addiction to reward and etc. So these are the causes I have mentioned. Now, looking at proximal causes, we know that maladaptive cognitions cause proximal causes about self and about the world. So cognitions about self is usually led by a ruminative style of thinking. And the cognitive distortions about the self are including issues like low self-esteem and low self-efficacy, and having self-doubt and negative self-evaluation and appraisal are also listed within cognitive distortions. And cognitive distortions about the world often includes a sort of a pattern of generalization, and procrastination also plays a prominent role in the development and maintenance of these causes. Another model is the Kaplan model for preference for online social interaction, and this is actually built upon Davis's cognitive behavioral model. Lonely and more depressed people who perceive themselves as incompetent socially look for more safe and less threatening situations or places for interaction. And due to this limited or reduced nonverbal signs or cues, and because there's a greater sense of anonymity online, we can see these people who interact express themselves in a more calm and comfortable way and confident way. And due to increased self-disclosure, they end up controlling themselves more in these situations. And Moran, Martin and Schumacher in 2000 stated that the internet can be socially liberating, the Prozac of social communication, so to speak, they said. And the influence of psychosocial distress or negative outcomes because of internet use or abuse might be mediated by preference for online socialization. Now, Schaffer's component model is the third one. Schaffer defines various expressions of addiction through a single model, and most addictions, whether it's substance or some sort of object, they say that they have some common psychosocial grounds, some tendencies, some neurobiological tendencies, as mentioned by Janer. He said that the roots are similar to substance abuse when it comes to internet addiction. He said, quite rightly so, and some risks and issues are listed under a common addiction model. Depending on reward deficiency hypotheses, some people get less satisfaction from these rewards, and they usually seek some enhanced stimulation from reward pathways, turning to substances, or in our case, internet. And they prefer immediate reward with minimal delay, and also is a risk factor, and also another risk factor is obviously impulsivity. Learning theory of Wallace was developed earlier than others in 1999, and according to this theory, these people learn more through feedback and reinforcements, and internet induces their well-being and euphoria. And in anxious or shy people, they avoid face-to-face conversation and prefer internet communication. And this obviously helps the development of addiction, and there's also focus on disposition. When we look at Kraut's model, the rich gets richer, it says that the internet is a kind of amplifier. So you can enhance your skills if you have some social skills, basically, he says. If you're more depressive, or if you adapt less or not as well, internet may have more negative effects, and you may tend for more addiction. And lastly, Metellus Brand's I-PACE model is the one I'd like to talk about. Well, this name is obviously an abbreviation of an interaction of person, effect, cognition, and execution. So it includes the following main components, such as predisposing variables and effective and cognitive responses to internal and external stimuli, executive and inhibition control, and also decision-making behavior resulting in the use of specific or certain online and internet applications, and the results using internet application, results stemming from using internet application. Basic characteristics in psychopathology are seen here. Specific motives, social cognition and personality are also listed, and how are the affective reactions and how it is processed. This leads to gratification, reward, and then we talk about specific motives that reinforce this. And in specific internet addiction, generally we see that these people have some tendencies such as playing games or sexuality or pornography. Then using the internet gives them a more rapid and faster opportunity with minimal delay to reach these addictions or to access these addictions. Now, after the models, let's focus on some psychological correlations and risk and protective factors. Stressful and traumatic events play a role in internet addiction onset. Especially, chronic mild stress does stimulate behavioral addictions, according to Serene. Now, negative relations with others, self-perceived loneliness, sadness or anguish and anxiety are risk factors. And in males, trauma memories, and in females, problems with regulation of affects do increase the risk of problematic internet use, especially during later years of adolescence. Impulsivity and lack of perseverance are very prominent risk factors. Harm avoidance, seeking novelties, dependence on reward, and lack of or low cooperativeness are also risk factors enhancing internet addiction. Now, when adolescents' feeling of loneliness, boredom, and also low self-respect, when they believe they can't cope with these, these sort of adolescents also resort to internet use. And there's a theory on 5 characteristics, and when we make an evaluation, we see that low adaptability or agreeableness, low conscientiousness, high openness, being open for novelty, high neuroticism were also positively associated with the onset of problematic internet use. Also, extroversion, being an extrovert, is negatively associated with problematic internet use. Well-being, self-respect, self-control are all related to decreasing the severity of problematic internet use. Also, insecure peer attachment is effective in problematic internet use, and we see that this occurs more in males playing games, and also overusing sexual materials are also a mediating factor. Looking at familial risk factors, we see that the poor quality of relationship and attachment between the parent and the child is a risk factor, strong predictor, and separation and autonomy problems and the parents' expectations and behavior also play a key role in enhancing internet addiction, and in also separated or disengaged families, and in the case of adverse life events, the problematic internet use or addiction risk increases, and lower levels of perceived care also increase the risk of internet addiction. And we also see that there's high positive outcome expectancy of internet use, and also a high amount of disapproval of internet use by other people around, and high frequency of other people's invitation to take part or use the internet, and high virtual social online support also increases the internet addiction risk. And a very high subjective well-being or the thought of doing that decreases the risk of internet addiction, especially in females. Social networking sites and for males, online games are mostly related with problematic internet use, and using internet every day and online shopping is related with problematic internet use.
bahsediyor. Gerçek dünya, yani dünyadan.
And we're talking about a cycle from an offline world to an online world. We see a cycle here. Escaping from real-life problems, academic issues, avoidance of social or family conflicts, lack of offline sociability, and deflection from basic activities and developmental tasks lead to problematic internet use, which leads to positive or online reinforcement, such as from virtual sociability, belonging, chat rooms, and also a sense of security 24/7, a self-affirming environment, and promotion of self-esteem, receiving rewards with minimal delay, and also looking for identity, especially in adolescents, also leads to problematic internet use, feeding back to negative offline world reinforcement, causing a sort of vicious cycle. My slide here has slided a little bit. So if we see a table here on interpersonal variables, we're talking about here sociability, social support, self-esteem, self-efficacy, well-being, satisfaction,
internet bağımlılığı azaltırken
and also temperamental character traits. Coping with stress are factors, obviously, that play into the hands of internet addiction. And also a better functional family is also a protective factor. And this is a review, by the way. I forgot to write it. We see that issues related to family have less effect, though identity factors and risk factors related to identity and personal traits play a key role. I can't really comment on the right side due to the slide's malpositioning. Now, when we look at the risk factors of age, we see that for males, low academic performance, withdrawal and anxiety symptoms, and also protective parental style are protective factors for primary school students. Low academic performance is a risk factor, by the way, and obviously protective parental style is a protective factor. For high school students, ADHD, aggressiveness, and higher sensation seeking and lower self-respect, and also lower teacher autonomy, lower teacher support, lower psychological needs being satisfied, and also high exploratory excitability, low reward, low self-respect, low family functioning, and abuse of online games are also risk factors. So a high level of positive youth development, academic success at school, and a better functioning family are protective factors. So, talking about internet addiction comorbidities, there are different subjects, different trials, depression and aggression, and OCD symptoms and anxiety symptoms play a role. Problematic internet game use group shows more severe depression, conduct disorder, emotional symptoms, hyperactivity, and also highly perceived stress also play a key role. Thank you for listening to my presentation.